Right. So our next panel. We have been talking at length in our larger climate and health community about the mental health crisis that's being faced by youth. As a pediatric hospitalist, the number of youth that come into our emergency room in crisis and are held there for 3 days because there are not enough beds, and then they go back out into the community without getting their services. And we know that the climate crisis is making that mental health crisis even worse. So I'm very grateful for the work of the APHA on this issue. And now I'm going to introduce Leyla McCurdy. Leyla is the founder and chair of the Children's Environmental Health Committee of the American Public Health Association and chairs the Climate for Health Executive Committee at Eco America. She's also a board member of the Children's Environmental Health Network. Leyla will be moderating, and our two other speakers today are Michelle Loosli, who's the Senior Manager for Climate Education at APHA's Center for Climate Health and Equity, and then finally, Dr. Elizabeth Pinsky. She's a child and adolescent psychiatrist and pediatrician at Massachusetts General Hospital, where she's the Associate Director of the Pediatric Psychiatry Consultation Service and at Shriners Hospital for Children, Boston. Welcome.
Good afternoon. Thank you for joining our session, Youth Engagement and Climate Solutions and Mental Well-Being. As Lisa mentioned, I'm Leyla McCurdy. I'm the chair of the American Public Health Association Children's Environmental Health Committee. And I wear multiple hats, so you may know me through other channels. But I am so happy to be here with all of you, both personally and virtually, and to be part of this dedicated community of health professionals and partners who all share the same mission and are willing to raise their trusted voices to bring climate solutions. As we know, we discussed it over and over again during the day and also came equipped with this knowledge. But still, I want to repeat that climate change is an imminent threat to our human health. Children, especially children of color and children from low-income communities, are more vulnerable to the physical and mental health impacts of climate change. And our children are mostly aware of this threat and need our support to help them deal with it, both physically and mentally. One of the ways we can support our children is by providing them with the knowledge, tools, and skills which can empower them to take action for climate solutions. This session will provide an overview of the mental health impacts of climate change on children and describe intervention strategies we as health community can employ in order to protect their physical and mental well-being. And I'm really, really proud to turn it over to our excellent speakers. And the first speaker is Dr. Elizabeth Pinsky, and she will be talking about youth mental health, the climate crisis, and emerging strategies to foster resilience, engagement, and hope. And our second speaker is Michelle Loosli, and she will talk about the APHA's Climate and Health Youth Education Toolkit and using that in engaging youth through education. And we're expecting to have a discussion following these presentations. And now it's my pleasure to turn it over to Dr. Pinsky. Thank you.
Thank you, Leyla. And hello, friends. How is my volume? All right, terrific. So it is awesome to be here with all of you friends. Leyla gave kind of an overview of what I'm going to try to cover. And it is a lot of stuff. I'm going to try to cram it in and leave time for discussion. But as I've been sitting here listening to the talks and sort of spending time and breaking bread with all of you, I want to pause for 1 second because we have this, we have a tendency when we're talking about climate change, and particularly when we're talking about mental health impacts of climate change, to kind of to behave like clinicians, right? And to observe it and talk about what we see and what people are experiencing. And so I'm going to ask folks, does anyone here have some climate distress? All right, a couple of people have their hands down. I want whatever, someone with their smoking. Does anyone here have a child or a child in their life or a young person who's distressed about climate? Yeah. Anyone's child angry? Like maybe at them, maybe at the world? Yeah. So I just want to pause at the beginning and sort of frame us, just take a moment to frame us around that and around the fact that when we are talking about children's distress, human distress, what is happening for people, we are all in that boat. We are talking about ourselves. And I firmly believe that some of that internal work around figuring out how we feel about climate and how we wrap our heads around the enormity of this situation is really critical to getting to the climate solutions, to the stuff that we're all talking about, this sort of future that we can envision for ourselves. Okay, so that's where we're going to start. I'm going to try to get it all in, and I'm going to try to cover 4 different areas. I'm going to first, because there's many experts in this room, I do think that still understanding how climate impacts mental health is a little bit fuzzier and a little bit more confusing for some people. So I'm just going to let you know sort of how I think about it and what framework I use. I'm going to do that super quick. Bob already did some of that work for me. I'm going to talk about how and why young people are at greatest risk of all of those harms. And then I'm going to close by talking a little bit about climate anxiety and sort of how we conceptualize it, why it's important, and close by talking about what we can do about it or what the emerging research is to set Michelle up to talk about sort of what that looks like in action. Okay, good. And think of questions, guys. If I can manage to get through this, it'd be really nice to have some conversation at the end because perspectives about this are so different. Okay, so we're going to start here. Climate change is a mental health emergency. And in this context, where we're really blazing through, I'm going to divide that into 2 big chunks: direct impacts, heat effects, air pollution, and then effects that are mediated through trauma. And so again, Bob did some of this work for me. But there are direct effects of heat on a range of mental health outcomes, right? And some of that is just, again, things we all experience, like you feel lousy when it's hot out. You can't sleep, you can't think, you're cranky, kids can't learn in school. And, you know, not for nothing, Black, Hispanic, and low-income kids are least likely to have air conditioning in their schools as we think about sort of disparate impacts. And as Bob covered, thermoregulation is actually different in folks who in particular have chronic mental illness, and we make that worse with some of the meds that we give them. There's a range of mental health conditions for which symptom severity is worse when it's hotter out: violent, in particular suicide, mania, PTSD crisis presentations, all worse when it's hot. And then there's the effects of air pollution. And we know that air pollution increases anxiety, depression, lower IQ in children, also some emerging data around autism or autistic traits in kids. What I think is really interesting is the data around episodic poor air quality. So on days when particulate matter is high, on days when there's bad air quality, more kids present to the emergency department with psychiatric crisis presentations. We think about, you know, in Boston, at least I know where I am, we have a crisis in our psychiatric emergency rooms in terms of kids coming in crisis, grown-ups too. And you think about what that means as we sort of enter a new era of wildfire smoke and more days when the air is really poor. Okay. So those are the direct effects of climate change on psychiatric illness or well-being. There's then the effects that are mediated through trauma. And again, I'm being real sort of gross here, but there's sort of 3 broad categories. We already have a really robust disaster literature that tells us about the increased risks in the setting of acute exposures to traumas, things like hurricanes, floods, wildfires that are becoming more frequent and more severe as we get hotter and wetter and less predictable. I think PTSD is very intuitive for us, right? Like if you experience a hurricane and you think you might die, you're at risk for PTSD, but also anxiety, depression, substance use disorders, community violence, suicide. All of these are higher now, we know, for years. We have data after Katrina that goes out for decades now that people are still at increased risk if they experience those disasters. There's then the slower moving catastrophes, droughts, land loss to rising seas, encroaching deserts, forced migration, civil conflict, things that cause chronic traumatic stress that we know as mental health professionals leads to the kind of complex presentations that we see all the time in our clinics and emergency departments. There's then this sort of third mushy category of vicarious exposures to climate change. And this is the topic that has like exploded in the popular press, particularly when we're talking about young people over the last maybe 3 to 5 years, okay? And this is, this whole nomenclature has sprung up around it. Eco-anxiety, climate grief. PTSD is not a thing. That's not a thing, but people do use it. If everyone's familiar with solastalgia, so everyone knows that word. So I'm seeing a couple head shakes. Homesickness, the feeling of homesickness when you are already at home, but your home has changed around you. So this is what I felt yesterday in Boston on a 60-degree day, right? Like, do I enjoy this and take a walk with my children, or do I climb under my bed? Because like you, I have some climate anxiety. And I gave a talk, I was talking to somebody from Vermont earlier today. I gave a talk in Vermont in the fall. And this is an relatively old slide deck. I added this arrow. Why did I add that arrow as I went up to Vermont to give this talk? So Vermont had floods in July, floods with fatalities. And so there are places in the world, and places particularly in this country, where I think felt they had sort of the privilege of seeing themselves exclusively in this third category, this vicarious exposure category. It's like, I'm worried about climate and what's going to happen in the future and what's going to happen for my grandchildren. But on the inside, had a sense of sort of safety or privilege, honestly. And as the crisis deepens, what we're realizing is that people who thought
can we go by Petco before we pick him up to get some kitten food? I'm just worried that the cat food might be too big for her little mouth.
Increasingly, and with cascading traumas in coming decades, and places like Vermont that thought they were safe, nowhere safe, right? We're all in that same boat that I was talking about at the beginning of the talk. Okay, so those are mental health harms of climate change. All of these have greater impact in young people. Why is that? Some of it has to do with the increased risk that climate change has on children in every organ system, right? Whether we're talking about their lungs or their noggins or their hearts, their bodies are in development. And so insults that they experience have more impact. They also, breathe more air and drink more water and eat more food. They're just at more risk because of their physiology. But behaviorally, they are also dependent on adult caregivers and on structures, on schools, the things that are disrupted in the event of extreme weather. We know that when kids experience trauma when they're little, that leads to mental and physical health outcomes that last throughout the lifespan. We know that from the adverse childhood experiences data. And then there's temporality, right? What do I mean by that? Kids are going to live more years of their life in a hotter, wetter world. They're just going to experience more of it than older people. And then there's this psychological vulnerability that I think is actually relatively unique to young people, and I'm going to get into that a little bit more later. I can't pull up that slide about children's disproportionate impact without also acknowledging that not all children are equally vulnerable. So all of the things that put kids at increased risk, they're at increased risk for if they are also experiencing systemic racism, poverty, all of the things that increase their risk of being exposed to extreme weather, to amplifying hazards like chemical infrastructure, electrical infrastructure, all of those things. So not to mention sort of some of the air quality and heat island data that we've already talked about today. Okay. So coming off of that inequity slide, this data was really important. It came out in 2021. And prior to this, we already knew that young people worried about climate change much more than grownups did, which makes sense, right? Like we knew that. But all of that data came from like the US and Australia and England and, you know, mostly the global north. This was a study that looked at 10,000 young people in 10 countries in the global north and the global south. And what it showed us is that young people are really worried about this everywhere in the world, more so in countries that have been more impacted, but everywhere they are worried about it. And the take home is in that green box, which is that feeling worse about climate change was linked with a sense that your government, sort of the adults of the adults, weren't doing enough about it. So a feeling of adult betrayal was more linked to negative feelings around climate or climate distress. And I'm just going to throw this up for a second for people to look at it. These are thoughts about climate change that kids said yes or no to. I'm saying kids, these were young people. And this is all comers. Like, so feelings about climate change affect my daily life and functioning. That was more like 50% in countries that are significantly impacted. Okay. So that's kind of climate anxiety, those last couple slides, right? That's distress about climate change. So what do we think? Does this young koala have a mental health problem? You're saying no? Right. Right. So the koalas experience trauma, right? So like maybe the koala does have PTSD. Maybe the koala does have a diagnosable mental health condition. I don't know. But what's the problem with this? Why is this a problem to say that this koala has a mental health problem? Why?
Because we create the social and political system.
Don't get ahead of me, Robin. Slow down. Okay, I'm gonna get there. So number one, so there's 3 problems here, okay? And she's jumping right to the third. Number one, we're pathologizing the koala, right? We're medicalizing the koala's response. Anxiety is adaptive, right? Anxiety is the thing that we have that alerts us to a threat and gives us time to prepare for it, right? These are like the cavemen who ran away from the campfire and the cavemen who got eaten by the saber-toothed tigers. We need anxiety. But the second problem is that it doesn't just pathologize the koala. I would argue that it ignores the juvenile koala, the koala's youth. It ignores the koala's strengths and the koala's smarts. Because I would say that not only is climate anxiety not a mental illness, it is also a sign of health, right? And for my pediatricians and my psychiatrists in the audience, it is a form of attachment, right? To like the world and all of the people and animals that live on the world. It is a form of attachment. So when we say this koala has a mental health problem, we're ignoring the fact that the koala is perhaps the smartest person in the room, right? And we're not respecting the koala. But the third problem is what Robin's getting at, which is, so we have our poor traumatized koala, we have the clinical observers. What is missing from this cartoon? Who cut down the eucalyptus, you guys? It was the fossil fuel industry, right? This is what we talked about all morning. And when we talk about this koala as having a mental health problem, we are individualizing it. We are making it about the koala and not stepping back to say, okay, but the real problem is who cut down the eucalyptus, right? And so all of these articles that we all read and all the news, oh my God, the youth are freaking out about climate change. What are we going to do about it? At best, they have a throwaway line about like, oh, and we need to get off fossil fuels. The fundamental problem is not whether or not the koala has a mental health problem. The fundamental problem is that we are still cutting down the eucalyptus trees, right? Okay, so that said, I actually do think that climate anxiety matters. I don't believe that it's a mental health condition, but it does matter because climate trauma blocks climate solutions. So that's like one of that. Probably should have put that on the take-home slide, huh? Climate trauma blocks climate solutions. And that slide where I talked about sort of the different forms of trauma that are going to, you know, mush into each other. We're all going to experience them. Individuals, neighborhoods, communities, societies that are traumatized can't do what they need to do to transform us into that sort of future that we want, right? And so I actually do think we need to think about climate distress and figure out how to help people with it. I'm already running long as predicted, but so I'm just going to call our attention to a couple here. First of all, if it's mentionable, it's manageable, we just have to talk about it. We have to tell people to talk about it. Climate change, in my mind, is like racism. It is a topic that is super, super important that parents have an obligation to talk to their own children about early and often, because it's difficult, and your parents or your caregivers are who you should be talking to about it. And then the last one is this last point: encourage collective, boldface underlined action. Okay, one of the most important things that we can do to support youth with climate distress. Okay, which brings me to my final take-home point. Michelle told me I could run a little over. I swear she did. Well, so what do we do with climate anxiety? Like, everybody's talking about it. It's not totally like, is it an illness? Is it not an illness? No, it's not really. How much climate anxiety do we need, right? Like, most of us, if we weren't anxious about climate, we wouldn't be here at all. So we know it's got to be somewhat a good thing because it's somewhat motivating. Somebody, maybe it was Ed, brought up this morning, some of the data around anger being a really useful emotion in climate work. Maybe, I don't know who it was. Somebody brought it up. So there's all of these questions around climate emotions and the interaction between them and climate action, between what we need to do. And we have a lot of questions about sort of what to do and how to help people with it. But I'm just gonna, and these are new slides, guys, so you'll have to tell me how they land, because I was like, all right, this is a very highly educated audience on these topics. I need to up my game a little bit. This paper came out in 2022. It was small sample, I think 250 young people and a somewhat homogeneous sample. But it looked at this question around, is climate anxiety or climate distress linked to generalized anxiety and to depression? Like, how are they related? Do they have anything to do with each other? And the take home of this paper was that for young people who have both elevated levels of climate distress and an emotional impairment related to their climate distress and symptoms consistent with depression, specifically collective action attenuated that link. So young people who didn't feel great about climate felt better in the rest of their lives if they were taking collective action on climate. So it's not just that doing anything at all is protective, but specifically collective action. And I'm going to back up to some data that is now like over 10 years old from Dr. Ohala in Sweden, because I think it's related. So what she did was she took a whole bunch of young people, and these were kids, like I think 12 adolescents, 12 to 14-year-olds, who were worried about climate change. And she interviewed them and sort of chunked them into different categories and looked at them through the lens of emotion-focused coping, problem-focused coping, and meaning-focused coping. And it's interesting because this framework of thinking about coping in these different ways actually originally comes from studies of folks taking care of spouses with life-limiting illness, people taking care of their loved ones who were dying. Because it's about how do you keep going and cope effectively in a situation where you have to continue to function well and continue to take action, even when the outcome is uncertain and possibly negative. And so there's these kids, right? There's the emotion-focused copers, and they just want to feel better. They're trying to improve their negative feelings. Probably the most effective emotion-focused coping mechanism when it comes to climate, does anyone have a guess? It's denial, right? Like if I could feed everyone here, you know, the red, I'm not a Matrix fan, whatever color pill it would be, and just make you believe that climate change is not really a thing, you'd feel great, right? Like that would feel really good if you could wake up tomorrow. The problem is that it's not true, but it would feel good, right? But so these are kids who sort of, you know, they journaled or they, you know, decided to believe that climate change wasn't real, or they sort of coped in an emotion-focused way. There then were these problem-focused copers kids. And these are kids who are like, I'm going to research climate. I'm going to learn about it. I'm going to recycle. I'm going to do a beach cleanup. They like did something, because the goal of a problem-focused coper is to deal with the source of the stress. And then she looked at how did kids feel when they were done, and were they engaged or not, right? Because that's what we're going for. We're going for both feeling a little better and for being engaged. And what she found was that the emotion-focused coping kids weren't doing anything about climate, but they felt better. The problem-focused coping kids were doing stuff. They were doing their beach cleanups and changing the light bulbs and doing all the things, but they still didn't feel very good. There's then this third category of kids, and I would argue also of just people who are meaning-focused copers. And those are people who draw on their values, who they believe themselves to be in the world, what they believe about humanity, sort of existential beliefs and values. And those kids, and again, I would argue people, are both more engaged and feel less rotten. And why am I throwing up this new slide at the end? At the beginning, how many of us raised our hands about feeling climate distressed, right? Almost all of us. And what are we doing here in DC on a random Sunday in February, right? We're taking collective action and we're doing something together. And I think that that is the take-home message from all of this, and from how we want to approach kids and counsel adults with kids in their lives about how to help them. What we're doing right now is meaning-focused coping, right? We're coping with the scariness of the situation and the direness of it by doing something, but not on our own. We're doing it together. And I don't have better data for this, but this is where I think the money is as we figure out sort of what we need to do in the future. And then I'm just going to end with this quotation from an essayist who I love. This is a very difficult read. She talks about sort of her family's experience with Jim Crow, but the entire essay is such a potent example of meaning-focused coping and sort of placing her own climate activism in this historical context, that again, it is a difficult read, but I think a really valuable one. And I hope I've accomplished those 4 points. I am now going to hand it off to Michelle, who's going to talk about an example of collective action. And you will get slides later. I did want to call people's attention to this one reference from Eco America and the APA, which is excellent if you're looking for a more in-depth overview of climate change and kids' health. All right, over to you, my friend.
Hello, everyone. It's so nice to be here this afternoon. I've heard Elizabeth's presentation, both A and B, and I've liked them both so much. They really set the stage for what we're doing at the American Public Health Association. Today, I want to talk about engagement through education and how that builds on children working together and putting together collective action, and also understanding better what it is that they can do and what steps they can take in their own life. Real quickly, basically, I'm going to talk about what we know about climate education in schools. So I'm going to connect us with the school system a little bit. Why health and climate is smart messaging. I think building up upon a lot of the work that's done here at George Mason, about why health and climate actually works as messaging and is less politicized. Why we see the toolkit, or the toolkit that APHA has offered, and I'll explain it, as a solution, and why your participation is a big part of that, and why it would be healthy for you as well. So climate education in schools. One thing that we know is that 75% of Americans believe that climate change is a problem. Of those 75% of Americans, what do they think other people think? Do they think that other people feel the same way? Ben, what's the answer to that? No. They think fewer people believe that. And so it keeps people silent and talking about climate education. Perhaps you've actually felt that in your own life, that you know that this is a problem, but you know that no one around you cares about it. But that's not necessarily true.
It's also similar with education. 86% of K through 12 teachers and 84% of parents with kids under the age of 18 believe that climate change should be taught in school. We know that only 3 states require it to be taught. And we've also well, I have a survey out here, but I'm not going to put the slide up yet. In a study of middle school and high school teachers who teach science, how many hours during the entire academic year do you think they teach? Do you think it's about 10 hours worth of climate change? Raise your hand. Fewer. Okay. Going lower. Who bids 6 hours of climate change? 2. Exactly. We've got a ringer at the front. He knew the answer. It's 2 hours or less of climate change in any given year, although everyone thinks it's an important thing to talk about. And I think that's the important thing for us to know, is that although we're concerned about climate change, and we know that parents are concerned about it and educators are concerned about it, children aren't getting that education in school. So why do climate change and health just work, and why is that an important topic and an important subject to have at hand? Well, we heard about it earlier today. Climate messages paired with health, for lack of a better term, they're palatable. People have experienced climate change. They don't maybe want to hear it as climate change, but they understand that a hurricane happened, there was flooding, and there was an outbreak of a disease afterwards. Or they know that the last summer here in DC, I think we really have been kind of removed from it, but last year our air quality plummeted with the effects of drifting forest fire smoke from Canada. And people start seeing this as something that's happening in their own backyard and something that they need help in understanding and need help in wanting to understand. I think when we talk about this climate messaging, people want to know what's going on, what's the risk for them, what are the solutions, and of course, as they brought up earlier, what's the normative appeal? So when we put those 3 messages together, people are really interested in listening about climate and health. And of course, this study, which is from a little bit later, but let's replace it with that slide we saw earlier today, that physicians are right up there at the top of who people respect and want to hear information about climate and health. So we know that you, or public health professionals, are people that can be listened to when it comes to climate and health. We know that teachers are having a hard time getting this message out in the school. And we know that it sometimes can be a politicized message. So if climate alone can be politicized, but climate and health is actually a little more palatable for people. So what we've done at the American Public Health Association is put together a toolkit where you can become some of those teachers in a public school system. This is a quick beauty shot of the toolkit, what it looks like. And it really is a comprehensive methodology for helping you reach out to schools and putting this message out there. We know you're here because this is one of your passions, and hopefully you'll want to take it into your community. The toolkit is really comprehensive. We have letters for you to reach out to a school. The toolkit itself is an adaptation of the NIEHS high school curriculum that they put together, and it meets Common Core standards. But because of barriers, it hasn't been widely adopted. So we're hoping that the health professional can bring it more closely into schools. Throughout, we give you a preparation checklist if you haven't done this before, that you can check off what to take to the schools. We also give you teaching tips throughout, and we give you an answer key in the back. In case you're uncertain of how X goes to Y goes to Z, we've got it there for you. I think what's really helpful about this answer key in the back is really a lot of what we're talking about with children is what are the climate drivers, what are the environmental conditions, what are the health effects. But if you look on the answer key, we talk about the health outcomes. We're talking about it specifically with which populations are most vulnerable. And also we ask you to talk to students about what are personal actions that they can take and what are mitigating strategies that they can implement. And with both of those things, it helps them start realizing that they can take steps forward. I love that analogy this morning, that they're no longer talking about polar bears having these problems, but they're talking about it in their own lives and in their own community and asking themselves, what can they do? Well, what we found out from teachers, one more thing I want to say is we've got a lot of interactive lesson elements. All of this is participatory education, right? We have students work on defining the problem, presenting it to one another. We also have gamified it with this climate to health relay race so they can understand what climate drivers are, the exposure pathways, what the diseases are that could come from that. And then we can have a discussion afterwards of what does that mean and how can they implement change in their own lives. And by doing this, we've received a lot of positive feedback on it. What is interesting about climate and health is that it's a new message to a lot of students. It's a new message to a lot of kids, and that makes it a little more exciting for them, and once again gets to that hope element. Last summer, EPA used this with several of their summer institutes for children, and mostly in high school age. And what they found out is most of the children responded, in fact, almost all of the children responded, that this information was new to them. They've spent their entire life hearing about climate and climate change, but they didn't know this climate and health element. And that was really important for them to not only learn about it, but also to start thinking about what they could do in their own lives to make a change. So how do you find it? If I were cool, I would have a QR code for you to scan here. I'm going to go with my coolness factor just went down. So here's the URL. But if you go to apha.org, and hopefully many of you already know our website, if you go to /climate, you can find it. Thank you for taking pictures. Climate-ed, you'll get to the toolkit. We also have a PowerPoint for you, so you don't have to put the PowerPoint together, or you can manipulate the PowerPoint so it works for you. The other thing that's really great about the toolkit, to be honest, it's a great reference guide for you. We link to not almost all, because obviously the almost all federal websites that have a lot of information about climate. I was preparing for a class in my community. I put down Arlington County. Kudos to Arlington County, because apparently 100% of those of us who live here in Arlington County are within half a mile of a park. And that kind of information is on various websites. And once again, those websites are referenced in the guide so that you can get to them and you can pull out that information and data for your own communities. I want to give a shout out to Leyla. So Leyla is the Children's Environmental Health Committee founder. And so she has really been shepherding a lot of this. And this is the Children's Environmental Health Committee website, that they also have additional resources for it that you can link to through our website. And all of these things will make it so that you will be a very skilled presenter when you go in front of a classroom and talk to 9 to 12 graders. Now, I'm not talking about, it doesn't necessarily have to be a classroom, or you could do, we've had people do it at summer programs. We've had people do this at after-school classes. It's about 110-minute lesson time, so it could take a couple of periods. But the question is, and perhaps you may be asking yourself, why me? Well, first off, what we've learned today is you're a very trusted professional. It's a great way for us to hear more from you and for you to share your expertise out there. When you engage in the community, you're taking your passion to the community, raising up an issue that, once again, we heard very few people are talking about, yet people are dying to have this conversation. It will build trust between the school systems and our public health system. It strengthens children and it builds their resilience, which Elizabeth just pointed out how important and needed is that. And then finally, do it for yourself. You possibly have anxiety. You possibly have concerns about what is going on with climate change. People who have used the toolkit also report back that sense of fulfillment they hear from working with children on this, and the lack of cynicism coming from them. There is some cynicism out there, but they're also excited about this. And because it's a new topic for them, they're also looking for new solutions, and they will bring that new solution into the classroom. And because I heard about call to action earlier, I got a call to action for you. The American Public Health Association has our National Public Health Week the first week of April. I'm sure many of you have worked with us on it before. The Wednesday of National Public Health Week is going to be devoted to climate, so please join us there. But we have also joined up with the Worldwide Climate Justice Education Week, which is April 1st through 8th. The idea is to get 30 minutes of climate education taught in classrooms or locations across the world during that week and have people report that back. We want to support this effort, and we're hoping, and it won't just come from you, but to have 600 people reach out and do climate classes throughout the globe. And we'd love you to join us in that worldwide initiative. I thank you for your time today. And I think if you haven't had enough about climate, health, and equity, we'd like to invite you also. APHA is having a virtual summit coming up on February 29th through March 1st. Once again, go to our website, apha.org/climate, and you can register and see more about it there. But thank you for your time today.
Thank you so much, both Elizabeth and Michelle. Elizabeth, for giving us such a wonderful overview of what our kids are dealing with today related to their mental well-being and climate change. And Michelle, for offering us this wonderful tool as an intervention to help our youth to get engaged in climate solutions. And at the end of the day, as Elizabeth demonstrated so well, getting involved possibly with some collective action, which will be a really good contribution to their mental health. We are following up our previous model. We will put out some flyers. This flyer is actually one that I don't know if you can hear me, sorry. This flyer is, these are all on the website, but this flyer is specifically developed to supplement the toolkit to get kids engaged in climate solutions. And the first thing that we tell them is prioritize self-care. And the QR code here will help you to get to the toolkit. And this other flyer is one that Elizabeth already mentioned. I should say Dr. Pinsky, I'm sorry. Is the climate change impacts on children's mental health report from Eco America in partnership with American Psychological Association. It has all the information you need regarding this topic. So I'm going to put those out there. Please feel free. Also, my email, please feel free to reach out to me anytime. My email is Leyla McCurdy, which is my name, @outlook.com. With that, I'll open it up for a few questions. I think we are almost at the end of our time. Can we, yeah, a couple of, thank you so much. Can we have, oh, yes, Ed. Wonderful to hear from you, please.
Wonderful presentations, both of you. Thank you. And Michelle, the 2 hours of climate instruction in the average American high school and middle school, most of those teachers, they understand the realities of human-caused climate change, but they're teaching both sides because they're feeling pressure from the parents in their schools to teach both sides. So it's really quite a crisis of education. But I have a question for you. It's a real dumb question. I should know the answer, but my youngest child is more than 10 years out of high school, so I've totally forgotten. Are there still health teachers in our high schools? And if so, might not the toolkit, might not they be the most natural avenue to get that toolkit into use?
So we're definitely, you can hear me, right? We're definitely reaching out to both sides. We've got a major campaign reaching out to education associations to try and reach out and start doing these types of presentations there as well, because absolutely, they are definitely the people who could do this. And I think the other thing is we're trying to use the toolkit, we're not trying to just locate it within the science class or within the health class, but within the English class and having people talk about English stories that they can create around this. And it's where a teacher is most interested in it that we want to get there. But I agree with you. I think one of the things about if we go in as public health professionals to teach perhaps on a teacher off day, or if we're doing it in a club, we get to control the message, which I think is really important. I think you're absolutely right. And thank you for all the work you've done on this.
Thank you so much. Before I go to that question, just one little addendum to what Michelle already said. You know, we are asking you, of course, to get engaged. You know, we are all for that. But please don't feel pressured like you actually have to do this. We have another flyer as part of the toolkit that, you can use to reach out to others in your community to actually be the volunteers to teach this. So there are many, many ways for you to take action that can lead to some offering of this education in schools. Yes, please. Thank you.
Thank you for the great presentations. Especially, I love the meaning-focused format and framework, because that's what I see in my population if I've cared for my entire 40 years. And what curriculum or what we've built around that, especially in vulnerable populations which have survived all their existential stresses and threats day to day for centuries because they're so meaning focused, and bring a approach to the children that builds on what they get at home to be able to take on this climate crisis, because many times they talk about eco-anxiety and the population I deal with think it's very odd. And they don't relate to it, and they see it often like an upper middle income, other majority people with wealth response, where they are also traumatized and are not as action prone because they have so much meaning focus, value and response, but they do need the education. But I think much of our education doesn't relate in a group of, especially children that come from communities that are meaning focused in their response. So how are we going to create curriculum? And my other concern is the pediatricians right now are really, the practice has changed, and it's really controlled by the large corporations, the large entities that have other folks doing this work. Have we had any inroads in working with the people who really control how care is delivered, especially for the Medicaid population that I work with, where much of the education is taken out of the hands of the provider and is left in a the mill that they do. So how do we address that? Because they are the most vulnerable, and our systems are not really responding effectively.
Just to
So I mean, I think we are also, can you guys hear me without the mic?
Nope.
Sorry, online folks. I love that comment. Thank you for that. What I would say is that we know from the survey data that Black and Brown communities are more worried about climate change than white folks are, but that does not map onto this concept of climate anxiety, right? It doesn't map on. And when I feel like hopeful about this work, when I can get sort of jazzed and hopeful, I was just talking to Howie about this earlier today, it really is about the multi-solutions for so much that is going on in terms of violence, community disconnection, climate. All of this stuff is one problem that has to do with, at its core, injustice, right? Like climate change is just injustice manifested physically. And so I don't have the answer to your question. I think it's like but I think that is exactly the question, is like, how do we address all of these different ways in which we are broken? And I do think it has to do with meaning focused coping, but how you put that on a slide, I welcome you to tell me.
I just wanted to try to comment as well. Thank you so much. And we need to keep on raising these issues all the time. And I really appreciate you bringing it up. Your second question is a little bit more complex, and in terms of how we deal with the systems that are feeding the information. And I don't have a quick answer for that. But I will try to answer your first question, which is, in the classroom, how do we engage students who are in the classroom or where this education is giving? As we said, it can be outside the classroom, in clubs or summer camps. But what we did was, when we were creating this lesson plan, adjusting it for public health professionals, we added an EJ component, and we have to call EJ extension. And we worked with an EJ coalition that is led by two high school students, because this targets high schools. So there are activities in there. Just take a look. There's an EJ piece to it, and our hope is that it's going to be included as this is being taught in the classroom. I think that's all the time we have, right? Sorry, please contact us. Thank you so much.